Hello, I am Dr. Abhay Bhave. I am a hematologist and I am practicing in S L Raheja Hospital. Now today we are going to talk about a condition called as anemia. What is anemia? Well, anemia is when the hemoglobin goes low, when the RBC count is low or the hemoglobin level is low. The normal hemoglobin value in an adult male is usually in the range of 13.5 or 14 and above. And in a female, it should be at least 11.5 to 12 and above. Anything below this value is considered to be as anemia. Now, why should we be worried about anemia? Why are we talking about anemia? For the simple reason that anemia causes some symptoms that can affect your quality of life. What does this mean? Anemia causes you to feel tired, fatigued, restless. At night, you don't sleep well. You feel a low self-esteem. You can't do the kind of work which you were doing before. You are lagging behind your colleagues. You're not doing as much work as you could do before. You try to go up the stairs of a station. You try to take a bus. And you feel extremely tired and fatigued and you start feeling breathless. You see that I can't do what I could do in the past. These are all symptoms of anemia. Now, if there are symptoms of anemia, then we have to know why did you have this anemia. So there is a systematic approach for this. Now remember, there are different types of anemia. So the anemia that may be there in your neighbor, your family member may not be the one that you have. So it's very important that you assess the anemia independently. The best way is to start with visiting your doctor. By visiting your doctor, who will ask you certain questions and do a physical examination. What do we examine? So for people who have symptoms like what we have discussed just now, we look for, is there jaundice? Are you looking pale? Have you become fairer? Because that's where the hemoglobin goes low, you look fairer. Do you have swelling on your feet? Is your respiratory, your breathing rate a little high? Do you have any signs of crackles on your nails? Is there change in your skin color, hyperpigmentation? Is your tongue bald? Is your liver or spleen enlarged or palpable? Do you have any lymph nodes? All these have got tremendous amounts of value for assessing anemia. Now, once your symptoms have been taken into account and you've been examined, we will do a blood test. And the marquee blood test is called CBC, complete blood count. This is a machine printout of a sample of your blood, which tells me, do you have hemoglobin low? And if so, what are the indices? That means what's the behavior of your hemoglobin? It's quite clear to us from a CBC, and then we look at your blood slide under the microscope. We come to know quite a lot about your blood. We come to know, are you a type of anemia that is because of a production problem, destruction problem, or you may not have either of these two, you might actually have loss. So clinically, we divide anemia as production, destruction and loss. That's how all the history taking and the examination is done. And even from the slide, we can come to know what's happening to you in terms of the type of anemia. Once we have deciphered that you have anemia and we have a fair idea as to what type of anemia, we actually might do further investigations to either corroborate what we are thinking or to get proof of what we are thinking. So sometimes beyond CBC, we'll have to do investigations such as iron levels, vitamin B12 levels, folic acid, breakdown of blood like reticulocyte count, LDH. All these are tests to be done to find out what is the cause of anemia. Most of the times from this basic test of CBC and certain other basic investigations like reticulocyte count, LDH, direct Coombs test, we can come to know what is happening to you. Sometimes we have to do an endoscopy to find out, are you bleeding in the intestine? And you'll be surprised. Sometimes you can pick up some very sinister causes like cancer of the colon, cancer of the stomach, ulcerations, growth, malabsorption. 67% of the times, the answer of an iron deficiency anemia can be picked up in the intestine. Sometimes when you look at the blood slide, we see something's wrong. The common causes of anemia in the public, in the community are what? Iron deficiency anemia, almost 50 to 60% times. You heard me right. 50 to 60% of the times iron deficiency is the cause of anemia. And it's sad. In a country, in a world which has got good food available, it is sad that we are looking at iron deficiency anemia as one of the common causes, despite so many nutritional programs by the government. It's sad, but that's the truth, that's the reality. But other than iron deficiency anemia, there could be vitamin B12 deficiency, folic acid deficiency, breakdown of blood. So from the slide, we'll get an idea. In an investigation, we get an idea. But sometimes on the blood slide, we pick up some bad cells, abnormal cells. They could be cancerous cells. So yes, remember, sometimes the anemia can be because of a dangerous cause like cancer, blood cancer. Looking at the blood slide, we can come to know that. Sometimes we have to do a bone marrow examination, which is done from the hip bone, a very safe, simple local anesthesia procedure which is done to find out how on what kind of blood are you making. Simply put, bone marrow examination is done from the hip bone. Bone marrow in the hip bone is like a factory which churns out blood. So we tend to look at the factory. What kind of material or cells is the factory making? If there are cancerous cells, then it will affect the hemoglobin and the anemia will be evident. And that diagnosis of leukemia will be made from the bone marrow examination. And we do additional tests in that to find out what type of blood cancer it is. Sometimes it may not be blood cancer. It may be just less production of blood inside the bone marrow. Aplastic anemia, pure red cell aplasia, myelodysplastic syndrome, and other conditions like myeloma. What I'm trying to impress upon you is that there is no one answer for anemia. Remember, anemia is an event. It is not a diagnosis. That event has to be analyzed to find out what is the diagnosis. It's like smoke and fire. Don't run after the smoke. Anemia is like smoke. Go after the fire. That's where the diagnosis is. Once you make that diagnosis, it's easy to treat and the anemia will come under control. Sometimes anemia can be brought under control with iron therapy, orally or intravenously. Sometimes with B12 injections or tablets. Sometimes just blood transfusion. If the underlying cause is the cancer, then treatment of the cancer. And today, we've got wonderful new agents like erythropoietin, darbepoetin, and newer agents that helps to increase the hemoglobin. But all this will happen if you come to us. If you come to us with symptomatology, we can diagnose. And remember, the earlier the diagnosis, the better we'll be able to take care of you without giving you blood. Blood is like putting petrol into a car. It works for some time. Then what? So the answer is not to take blood transfusion. The answer is to find out why the hemoglobin was low. Treat that cause and you'll be able to get fine. Otherwise, you'll end up in that vicious cycle where you'll keep taking transfusion because you don't want to diagnose. Don't be scared. Don't be afraid. Today's world is different. Our facilities are fantastic. We are able to make proper diagnosis and give you that quality of life which you always deserve. Remember, by taking care of anemia, your quality of life will improve. You'll be back to productive life, back to work, back to job, back to earning, back with your family and looking at so many events in your life. Thank you very much.